Hi, I'm John Isaacs. I'm the medical director here at Quail Corners Animal Hospital in Raleigh, North Carolina. Here at Quail Corners Animal Hospital, we brought VetOvation in about a year ago. It has been a wonderful experience for us. The really nice thing about this was the equipment is flawless. It works smoothly. We've gotten great training with it. I have a large practice here. I have 9 doctors that work with me, and all of them have been enthusiastic about doing this. I've had doctors here that were not into surgeries itself, but they have really become enthusiastic with this because their visualization is so great and the enthusiasm. This has been a real morale builder for not only just the doctors but the staff to see that we're on cutting edge technology. So when we brought in VetOvation and doing laparoscopic procedures, it has helped our clinic immensely because not only can we do better procedures than we were doing before, but the enthusiasm of the staff members and the enthusiasm of the doctors in order to do these has helped promote these good procedures to our clients, so we've been able to do more of them. Procedures that we're doing now include all abdominal procedures that we can routinely we're doing as through normal surgeries, but now we're doing many of them laparoscopically, and we're being able to send patients home less painful, recovering much faster than they did before, very mobile, much quicker, eating much faster. The whole procedure is just way better. The VetOvation system is really neat. The equipment, as I said before, is really pretty flawless. It really works well together. The idea with this is that when you buy this and when you get into this program, you're thinking about laparoscopic procedures basically. But this equipment is different modules of many things that work together. We use this equipment in a lot of different modes, and the doctor's ability to find new ways to use this stuff is just amazing to me. In order to do laparoscopic surgery, one of the things that you have to have is called a vessel sealer. This is a device that you use intra-abdominally through the ports of your laparoscopic surgery system, and this is how you ligate blood vessels to remove organs like taking an ovary out, if you're going to seal off a blood vessel that while you're in there, if you're doing a spleen or whatever. So if the doctors are doing a different surgical procedure, say they're doing a routine splenectomy, and they have to, because they've got a big tumorous spleen that they've got to get out of there and they want to get it out fast because it's bleeding, they use the vessel sealer all the time for that. It's cut their surgery time dramatically. They're taking out spleens now in about 8 minutes, and the biggest time is open it up and close it up. And so what they're trying to do is make a small incision as possible so that they don't have to take as much time closing it up because they can get the spleen out so fast. They're using this vessel sealer for other things too. Some of the doctors here are using them to remove tumors on the body, such as mammary tumors or things, and these aren't laparoscopic procedures, these are routine procedures. The other thing is that the camera that we use with this laparoscopic VetOvation system is super. It's got over 30 times magnification. So we use this camera for lots of stuff. It takes great pictures, the capture system is really neat, it downloads well, it goes to a computer, you can show clients things right away, and it does little movies and things like that with it. So we use a lot for doing ear procedures, when we're looking down throats, when we're doing rhinoscopy. So we put this system together, and even though it's laparoscopic, it's rigid endoscope, and so we do lots of rhinoscopies now that we didn't do before. Another thing that we've done to help us to utilize this system more, utilize this equipment more, is now we do lots of soft palate surgeries, where before if we had a big bulldog, difficulty breathing, some of my doctors were pretty hesitant about doing that because of the risk factors, the bleeding things, even using a cautery system. But when you use a vessel sealer, it works much faster and it's no bleeding. And so all the doctors have to do is get into the throat, get into the mouth, get it to where they can visualize the soft palate tissue that they want to do. Using the vessel sealer, they take it out. In this past year, we've done way more soft palate surgeries than we've done in the 4 years that I've been here for before. So there's lots of different things that you can use this system for that really help to recoup it. One of the biggest surgeries that we have turned around on using this equipment for to take out is doing gastropexies. So I have a number of doctors here that do surgeries. Gastropexy was one of the surgeries that they do. Anytime we have a GDV that comes into the clinic, we always do a pexy with them at the time of that surgery after we flip their stomach over. But doing prophylactic gastropexies is one of those things that it's a difficult surgical procedure to do when you're doing a spay or talking a client into doing it when they're neutering a large breed dog. But now that we use this system, the doctors are enthusiastic about recommending it to the clients. They really tell them what a life-saving procedure it can be. And because they can do gastropexies now laparoscopically, and it's so much easier for them to do, they get get great visualization. They get that stomach lifted up, they get it sutured together. They can use that camera to look at their suture line, both sides, and make sure that they've got good adhesion through there and they've got a really good hold. They feel very comfortable with it. When the dogs go home that afternoon, they're happy, they're alert, they're moving around well. So the doctors feel good about doing the surgery, they feel good about the outcome of it, and then they just show that to the clients beforehand when they're talking to them about the procedure. So because they talk it up so well, clients are like, okay, that sounds like a good thing. I think I'll go ahead and have that done.